So we are at the second part. Now we will ask some questions, some vital questions to Dr. Sharma, and he will answer all those questions, and you will get the necessary information regarding your canine. Okay. So Dr. Sharma,
Good evening, Dr.
good evening. Please take a seat. So when did you start this clinic?
It was started on 2020.
Okay, 2020.
20 years back.
2000, 2000. This is
19
2000.
two in 2000.
Okay, 20 years back. Okay, no problem, no problem. Uh, no, what are the facilities? Actually, we have seen in the previous part your chart of X-ray rates and everything. But what are the machineries or what are the equipments you possess here? Can you show us?
We are having this one is IDEX laboratories from IDEX laboratories head test 008008. This machine is for blood test purpose. We do the different tests here like LFT, liver function test, kidney function test, blood sugar test.
Okay.
Different kind of tests are done here.
Okay.
This one is for blood test.
Blood test. Is it a costly one?
It's a costly one. For the cost of this one is approximately 8 lakhs.
8 lakhs. Okay.
And secondly, we are having one X-ray unit, the CR system of X-ray unit.
Okay. What is this? What is this?
This one is computer monitor to see the different X-ray views of different X-rays. For example, this is a X-ray of a animal which is admitted here in our hospital. It's in the top floor. The patient is in the top floor. The X-ray was done. Then it's having some problem in the genital system. It's in the urinary tract, and some stones are there and many problems are there. After doing the X-ray, we were able to then distinguish the different abnormalities. And
But do you remove this by surgery or medicine?
surgery.
Okay.
We do surgery, different type of surgery.
Okay.
And this is the printer for that same X-ray, and it's the assemble of that X-ray CR system.
Okay. Good. Okay. But normally, doctor, in our public, there is a common concern, like what are the main or what are the common diseases that a canine can face, and can you shed some light over it?
Actually, main that viral and protozoal diseases are more common. For the small puppies, many viral diseases are there which are very deadly, and that diseases can be spread to human being also. It's called zoonotic disease, and some zoonotic importance are there. Two main diseases are parvoviral disease, canine distemper, leptospirosis, listeriosis, the hepatitis, some total 7 numbers of disease which are very deadly that cannot be cured, and it is spread to human being also. Some diseases among them are spread to human beings. So many care should be taken so that it cannot be spread to the human being, and that vaccination should be done properly at the proper time to prevent that diseases, and secondly to prevent the zoonotic point of view.
Okay. But normally, as we can see it in human beings, in hot or humid climate, those canines face some problems like upset stomach or like that.
Yeah. In high humidity, stomach problem is very common, and the skin problem is very common.
Which problem?
Problem of skin, diseases of skin.
Skin.
And
Okay.
some hematoprotozoal diseases are very common in northeast, like babesiosis, ardicosis.
Okay. What are the symptoms?
Symptoms that animal become anemic, they become depressed.
Okay.
The off-fed condition is there. Day by day, animal become weak and weaker, and afterwards they become dead.
Okay. This can be fatal.
Yeah.
That means. Okay.
So for treating this type of disease, we will have to examine the blood, different parameters of blood at the very first stage,
Okay.
and then accordingly we should go for treatment. So out of 10 cases, 4 to 5 cases of hematoprotozoal disease are coming every day.
Okay.
And in winters, that viral disease are very common. Many
Okay.
cases are coming.
Right. But what is the fatality rate in these diseases?
It's 100% fatal.
Oh my God.
The
That's very early.
parvoviral
That
disease,
means
canine distemper are 100% fatal. We
right.
are having different kind of kits for diagnosis of these viral diseases. For example, this is the kit for canine parvoviral disease, canine corona disease.
Okay.
Some corona diseases also there in canine,
Okay.
especially dog, corona for dog.
Okay.
So we are having this test kits.
Okay.
With this test kit, we can go for diagnosis of canine parvoviral disease at the same time for canine corona disease.
Okay.
If such type of patient come, then the very first stage we go for diagnosis of canine parvo disease or canine corona disease. And if we find that this patient is positive for canine parvoviral disease or canine corona disease, some different we are having some units which is
But
the
but how
segment
but how can you detect these diseases? Do you go for
after
blood
the
test or
yeah from examination of stool or examination of urine
okay?
from both point we can go for diagnosis of canine parvoviral disease at the same time canine corona disease.
Okay.
The positive cases, whenever there is the positive cases are there, we keep the animal in different room so that it cannot be spread to the other animal. And as because zoonotic importance are there,
Okay. That means isolation is a
isolation
much
is
needed
very
thing.
needed.
Okay. Okay.
Isolation is needed. We are having some isolation room. We keep the animal in that particular room.
Okay. That's good. That's good. But normally,
For canine
instance,
distemper also we are having some kits. That's for canine distemper. This kit is for canine distemper. For canine distemper also we are having kits, test kit.
okay.
With that test kit we can go for diagnosis of canine distemper.
No problem. We can look into it later on. Okay. Okay. So, doctor, this is the end of the second part.
Yeah.
We'll move to the third part next. Okay.
Okay.
Thank you, doctor.